Disease Awareness Day. When you have a spinal cord injury and it's affecting the cervical, thoracic, lumbar, you go through changes. See, I can tell my voice, my story, my journey like I do, and I give the list of what I have and all of these other things. However, in order to help raise awareness for the rare diseases, the necessity that I felt was, well, let's do education, because it's my symptoms and the way I handle it is different than other people. I'm not a professional. I'm not licensed. I'm just a human being who's been through it, who's going through it. And y'all have Google at your fingertips and you can educate yourselves at your leisure. Talk about spinal cord atrophy. It's also known as cervical cord atrophy. Pardon me. Today is just not a good day. So it's usually the late stage of MS, of the MS sequelae, which is particularly the most disabling form. Meaning that people who have MS eventually go into this later stage. People who have an injury that get to this means we just skipped all over and we're just at the bad part now, right? And so after the spinal cord injury, and so what happens is that the nerves go through a demyelination, which is the myelin on the nerves, which is what MS is when it starts disappearing essentially, right? So it goes through demyelation, which is also called the Wallerian degeneration, and the immediate phase is that initial atrophy, which when you have the injury, in cases you are in a wheelchair within a year, some of the symptoms that can be related to it: neck pain, back pain, weakness, numbness in extremities, pins and needles, sharp pains, everything and anything. Then what happens is that in most cases that first flare can last up to 5 years. And then you kind of go to a plateau, and then the plateau itself is implied with pain, because there's nothing that can help with the nerves. You're just in pain. It just that's it. You're just in pain all the time, and it gets annoying because the doctors, same motherfuckers, they're like, nope, you're gonna be in pain the rest of your life. It just is what it is, And for those of you, because I know you may ask about pain medications and stuff like that, I just happen to be one of the fortunate ones that my liver does not process any type of narcotic or analgesics. So a lot of the procedures that I have, the small ones, whether it's the injections or the ESIs and stuff, are done without anesthesia. But that's the power of the plant, y'all. A nice strong indica, boy, I'm out like a light afterwards. So there is power behind the all natural stuff that grows from the earth that can help. Obviously major surgeries, I use the anesthesia, but that's a whole nother story. So when it comes to that, and so with me and having the injury, so it went just like that to the stenosis. And at that time, that was April 3rd of 2015. As we're rolling up on these dates coming up soon, right? And so that initial phase, and my doctor had told me after that first MRI, I'll never forget, was on May 6th of 2015. And she said, this is progressive and we're going to do the best we can, but it's going to progress. You'll probably be in a wheelchair within a year. I was in a wheelchair within 6 months. And just a regular wheelchair, because at that time I didn't have like the brachial neuropathy and stuff. So the other things that come like as piggybacks with this, we won't negate for it, but we're trying to focus on the rareness of what comes with it. And so essentially, when you go through this, it's it can be difficult to explain to people, because people know what MS is. And people know what muscle atrophy is, but spinal cord atrophy, cervical spinal cord atrophy, and forget it. Trying to talk about the demyelinization and the Wallerian, things, over the head. So sometimes it's so much easier to just be like MS. The people know MS does this. However, the reason why it doesn't circumvent to that is because where MS has so many different things, when it comes to the actual atrophy, that means the spine itself is going to start to diminish. Eventually can cause a spinal collapse. In some cases because of the nerve, so it affects my peripheral nervous system, my central nervous system, my sympathetic nervous system. Sometimes it's more pain. You go into flares. That first one was like a good 3 to 4 years because I had surgeries and procedures and it was nonstop. And then you get to this plateau, like it says, that plateau. The plateau doesn't mean that everything stops. The plateau for me, because everybody's is different, for me, the plateau is how I am now. The ability and desire to want to live life despite having an end date, right? We talk about that. Wanting to be able to share my voice, my story, my journey, especially when it comes to these illnesses as well. But I have my good days and my bad days. And that plateau. And so with this, it rolls into 2 other things. But what I'm going to do is we're going to bring in those 2 things, and then I will go into detail. Next, we're going to talk about the complex seizures and TODS paralysis. Remember, you're not alone. We're in it together, and I love you.